for coming to February's Patient Voice panel, part of the Dr. Nabors Patient Voice series. This month, co-hosted by the Office of Health Equity and Inclusion and the Physician Assistant Program at the University of Utah. My name is Grant Sonata, faculty in the Physician Assistant Division, and overseeing this one of the PA program classes where we focus on developing skills related to community engagement and cultural humility. Three components of cultural humility I'd like to mention here to give you some context to this panel and the overall efforts is one, that we strive to be lifelong learners, self-reflective, and open to feedback. And part of that is also that we strive to recognize and mitigate power differences, be they interpersonal, systemic, or organizational. And so this is a chance for us to hear the patient perspective about health and really value their expertise about their lives. And the third part of cultural humility is to partner with advocates and leaders in underserved communities to give them voice. So a very similar theme as well with those power differences. So part of that process has been allowing some of our physician assistant students the opportunity to engage with underrepresented communities. And this month, Scarlett Reyes and Jocelyn Cortez are our co-facilitators. They've helped organize this panel, recruit, and we really appreciate the panelists taking their time and to do this. And I'll allow these two to introduce the panel. And thank you all for being here, including those connected through web stream. By the way, we will try to end at about 5 till because there is another class. So we ask that you try to exit through by that time and have conversations out in the hallway. Thank you again.
Thank you, Grant, for that amazing introduction. Just want to say hello, everyone. Just welcome to Patient Voices today, and we really appreciate your presence today. We want to thank, like Grant said, we want to thank the Office of Health, Equity, and Inclusion, not just for co-sponsoring this event, but also for allowing this opportunity for all of us. My name is Scarlett.
And Jocelyn.
She's Jocelyn. We're both first-year physician assistant students, and we're just super duper excited to be here today and learn more about our community members. Also, just a quick reminder, just please feel free to sign up. Please sign the sheet if whenever you have a chance, the signing sheet. And then today's topic is African American. We're super excited to have here our amazing panelists who took time away from their very busy schedule to share their stories and to be here with us today. I'll quickly mention their names, but we'll give them time for them to introduce themselves and share a little bit about themselves. Okay, so we have Michelle is on her way. She's an educational consultant. We have Melanie Davis. She's a licensed clinical mental health counselor and owner of Path Healing and Wellness Mental Health Clinic. We also have Dr. Bell, and then we also have Dr. Raphael. And then, like I said, they will have a moment to introduce themselves a bit more. And before we begin, we kindly ask you to just, share a bit, just listen respectfully and in this very friendly environment. And we're gonna have a Q&A session at the end of this, towards the end of this event. And just feel free to just make a comment, ask a question, and yeah, thank you.
Sure. Yeah, we'll start with me.
I'm Melanie Davis. I'm a licensed clinical mental health counselor and also a board-certified national counselor. I also am certified in nutritional psychology, a little bit of a different perspective to treating mental health symptoms with nutrition and wellness and food, which I love. We opened Path Healing and Wellness to really cater to the specific topic. Hi, Michelle. To cater to the community of color in Utah. I practice under a small practice for about 8 years and found that there was so much missing in the unique, safe created spaces for what I consider to be optimal mental health care for people of color in Utah. And so we'll talk more about it, but I opened Empath Healing and Wellness with that in mind. We do serve a diverse population, so we have people of all ethnic backgrounds that come to us, but we uniquely opened to cater to people of color in Utah.
So, my name is Dr. Stephen A. Bell, Steve Bell, and I'm a licensed recreational therapist, licensed and certified. But my role in employment and life is I'm a professor here at the University of Utah. I teach in the College of Health, and I am a recreational therapist and teach recreational therapy to our students. So what about me? I guess the panel kind of introducing ourselves. One of the things that happens when people of color, and for me specifically, black people, we meet each other like right now. It's like, okay, so where are you from? Because you can't possibly be from Utah. And we run into people and, oh, you are from Utah, so that's great. And or, oh yeah, okay, so you're not from Utah, but how'd you get here? And so that kind of creates the challenges for people of color in the state of Utah, kind of initially, to begin navigating their social environment. And so I'm really pleased to be here. I have seen some of these other panels for different populations, the immigrant population, I think Pacific Islanders, and the aging, and it's really nice to see this room as full as it is. So I really thank you and appreciate you being here.
I guess it's my turn. So I'm probably the youngest person here, so I don't have as much experience as everybody else, but I'm Raphael Corley. I'm from San Diego. Been living here in Utah for like a year, a little over a year. I'm a clinical psychologist. Moved here because I was a psychologist at the Department of Veteran Affairs. I'm no longer there, but I work for a company called Vantage, and I write modules for mental health for guys that are in prison. So it's kind of neat. I did my undergrad at University of Michigan, and I got my doctorate at the University of New Mexico. Utah is very interesting. So
I wanted to touch you when you said you wanted to marry here.
So I did some time in the Navy. I was a naval officer for a little bit, and I've lived in some really neat places. And out of all the places I've ever lived, I think Korea and Utah are probably the most just different. And there's pros and cons to that. But my focus is I was a social worker before, so I like to get in the trenches and I like to get in the dirt. So I like the grimy, gritty. I want to know the story. I want to know kind of like the homeless population I love the most. I feel like my biggest component is I guess I always say this, self-reflection is essential to growth, and I think that's pretty much what sums up why we're here, is because you guys are learning from us some of the pitfalls that African Americans and other people of color have kind of experienced, and to kind of uplift that and change the narrative. So thank you.
Hi, I'm Michelle Loveday, and I work in Granite School District for now, in the Department of Educational Equity. And so that's another reason why I'm late. Just like with your patients, I can't predict what my students are going to do. And so if someone wants to have a tantrum, we have to see that through on their terms. And so that's where I was leading up to this. And with that, in educational equity, I am working with our refugee population, our immigrants and asylum seekers, and I also run and operate the Tumaini Welcome and Transition Center. It's a newcomer school for all of our families that have never experienced American school system, and so they come to my school first, and we give them kind of like the quick and dirty version of what's going to be expected, and then we transition them to their boundary school. And so within that scope of my work, I then also work with our ELL population, our homeless population, the McKinney-Vento students, and other duties as assigned. And we run our MESA program, our Math Engineer Science Achievement, for our young underserved students and girls. And so it's a large department, and I just am excited to be at that place. I've been working in education for 18 years, first as a teacher and then a principal, and then now in this position. So it's a big to do, but it's a lot of fun, and in dealing with the populations. And so I've been in Utah for 15 years. So I feel his first 5 years of growth that he will have to face. And Utah is very different, and I'm glad to see you all here. I mean, even finding a doctor for me and my family was one thing that I struggled with, in a sense. And so it is great that you are all here to learn and gain some things. And after 15 years, I've made my home, I have family, friends, and we're here and rooted, which is great. But my heart is in Cleveland, Ohio. And so that's where I'm originally from. So the jump here was definitely a shock. And so it's been great being here so far, and I'm glad to be on the panel. Thank you.
Hi everyone, my name is Minerva Lobe. I am a second-year PA student here at University of Utah. I was going to say Nevada, that's where I'm from. I am originally from Cameroon, Africa. Immigrated to the U.S. at age 11 and grew up in Reno, Nevada, which is very similar to Salt Lake City, Utah. So I am kind of accustomed to being in an environment where there are not a lot of black people, and a lot of times being the only black person in a lot of places. But it's very interesting because I had a chance to facilitate this panel last year. And now I am in my second year of PA school. I'm a clinical student, and being on the side of a medical provider now as in my education, just kind of seeing some of the disparities and how I interact with patients and how I would counsel my fellow classmates to interact with patients of color.
And it's funny.
No, I'm done.
It's funny, my best friend was he graduated last year from this program, Antoine McLaughlin, and we went to school in Albuquerque. I don't know if you guys know him, and Hannah, but Antoine's my best friend. So yeah, we got our masters and all that stuff.
He's in Philly.
He's in Philly, yeah, I just talked to him now, he's like, yeah, tell everybody so.
Okay, well, thank you so much for telling us a little bit about yourselves. I think we have a super valuable panel today. I think we can all learn something and get some insight, since we'll be working with patients, and not just patients, just interacting with people every day. I think that this will be very valuable for us. So the first question we have is, if you could please describe a positive experience you've had with the healthcare provider or professional, and what made that experience positive for you. So I guess we can start.
I'll say the only probably memorable provider I've had as an adult was this fantastic dermatologist that I saw when I moved to New York, and the environment was wreaking havoc on my skin. And I had never been treated by a black provider. She was a black woman. She specialized in African American skincare, and so, trudged up to the east side to see her, and I remember the feeling I had compared to, well, really I had nothing to compare it to because I had never felt that way with a provider before. And I would say the most profound thing was that I felt seen. I felt like she really genuinely cared about me as an individual first, and then what she could do to support me with whatever my medical need was at that time. So I just felt comfortable, and she felt warm, and she felt very person-centered, and then provided medical care on top of that element of her practice. And that was really meaningful to me.
Thank you.
So I like what Raphael said, that he was the youngest on the panel.
He aged us right away.
Yeah,
It's
right.
like, you should
Threw everybody under the bus.
That's right. That's right. And, I used to be that guy. I was like, yeah, now I hang out and I am the oldest person everywhere. And so, yeah, I have a lot of life experience. And so, through my several years of living, I've gone through the model, the typical medical model of where, I can go back far enough that, there weren't very many female doctors. And if there were, they served female patients. And so, through my transition of that, I've had 2 doctors that have given me, my general practitioner doctor, the one I go to and see, get checkups, the change in the approach of providing services. Way back when, it was the doctor walked in, looked at you, tell you what the problem was, and they were out of there. And you're like, okay, I'm ill or I have this, but I guess I'll be okay. The change, the new, social paradigm is that there is discussion and interaction with your provider, which is something that, like I say, usually didn't happen. And so now, when I go to my provider, I do have a female doctor, and so, and I think that adds a level of engagement that, kind of comes around to being a little bit sexist. But, I do believe that there's more engagement in that, and so that gives me an opportunity to feel that I'm listened to, I'm heard, and what I have to say is of value, which should really be of value, because at that time, it is all about value. And so that's been a positive thing for my work in my assistance in the medical field.
As for me, I think the most memorable experience I've had as a patient would probably be when, I would say when I was in the service. I got a nice scar because I had some shrapnel go through my hand, and I had a nurse. She came over. She's like, "Hey, I'm gonna help you out," and it was just the care and concern. I don't think culture is universal, but respect is. And I think that as long as, like my experience is just like, wow, this woman's like working on me. Because I remember back, my mom would tell me, like, back in the day, fathers would, if a girl said, or a woman would say, "Hey, I want to be a doctor," like, "Oh, why don't you be a nurse?" Times have changed. So I think there's that level of respect. And I think that's what kind of, like, my experience was just like, she's like, "Hey, I'm gonna help you, I'm gonna take care of you, there's a problem, let's deal with it and send you on your way." You repeat the process. But I probably have to say it was that, because it wasn't just myself, but there's women and men in the military, and things like that happen all the time. So I think that's something that I'm proud of to see, and I think that that's pretty dope to see that. So.
Yeah, you've already got abusive. He's just set himself up for the whole time. For me, I would have to say, oh gosh, moving here and then looking for an OBGYN, that was great. Because, at first you have all the, I don't want a man, I don't want this, I don't want that, and then I was recommended a name a couple of times, and so I said, okay, fine, I'm gonna go to this gentleman, and the care has been great. But what set it apart was when I was pregnant with my first child, you go through the history, right? You list all the things, and on both sides, and this disorder, and this disease, and have you ever been, and have you ever been? And when I told him that I have thalassemia B, And then I went to explain what it was. He immediately stopped me and knew what it was and gave me the paperwork that I needed to have to get it cleared from the insurance, because they would look at the test that I would make to see if my child had it. They would charge me as a cosmetic test. So he knew that all, and it put me at such ease that I knew my baby and myself were at care, because if you don't know, thalassemia B is a Mediterranean disease. So it's obviously prominent in Black Americans. And not a lot of providers know that. Not a lot of providers know what it is, know how to deal with it, know what medicine to give, so that when I'm having those downs, tired spells that come with being pregnant on top of having it. So I felt such ease. I knew that during that entire pregnancy, all of my pregnancies, that he was going to care for me, and any lack of oxygen that I would have during the delivery, I just knew I was in good hands. So much so that when I was about to deliver quickly, and they said, "Oh, he's not here yet," I was like, "Okay, we're not having this baby till he gets here." Not happening. So I think as providers, when you're knowledgeable on those African American dominant traits, me being a sickle cell carrier and him being able to test my baby and look for that in utero, it gave me just peace during that transition. And I think all African American mothers need to have that. I didn't even have to explain it. And he retests and just makes sure that everything is good continually.
My experience is a provider that I have back home who is actually a PA. Shout out to PAs. But I feel like part of that medical encounter is validation of who your patient is, and the backstory behind their illness or whatever they're dealing with. Not just seeing a patient as, oh, well, you're African American, you have all these risk factors. You have risk factors for diabetes, hypertension, and all of this stuff, so now you need to be on medication. You need to be able to talk to your patient and understand what is it that they're struggling with? What is their backstory? What is some of the trauma that they might have been dealing with that's causing the manifestation of what you're seeing now? And so I know that might take maybe 2 or 3 extra minutes to get that backstory, but it's so important and going a long way to validate your patient and build that relationship and foster that trust. And now being on the provider side, when I'm in clinic and I'm seeing patients, that's the one thing that I've realized that people want. People want to be validated. People want to be heard. People want you to understand not just that, their neck hurts or their back hurts or whatever, but what is the emotional toll that it's taking on them. Maybe they're, taking care of their elderly parents and they have to lift mom from, in and out of the bed or whatever. So it's really important to understand that backstory to your patient's presentation. And I think it's even more important for African Americans because, historically there's so much trauma, there's so much socioeconomic disparity that has impacted a lot of our health. And it's not, like I said, we're not just a presentation of symptoms or checklists that you've learned in school, but we're people with emotions and a story and also want to be validated.
Thank you. Thank you for sharing that. I think something that stuck out to me was something I think that Michelle said was that you had some challenges finding a provider here. And then Raphael, you mentioned that respect is universal, even though culture might not be.
Right.
So we wanted to know if you have a negative experience that you could talk about with a healthcare professional where maybe you didn't feel that you were respected or that you faced some challenges. We can go if you're willing to share that.
Sure. I have one that jumps out to me, and it kind of piggybacks on what we just left off of, what creates positive experiences, the opposite can create less than ideal experiences. And I'm learning from behind closed doors that there's a lot of stress and push put on physicians now to kind of keep people in a certain time frame and see a certain amount of people, and I certainly understand that with how I design my clinic days also. But at the same time, I think this experience was probably a product of that. But I went to a clinic just kind of up the street, and I was looking for a new family practice doctor because mine retired. And I've had like a PFO closure and a couple other things that, like I have some medical history, I have had 3 children and things like that. So there was a lot of new information to share in this new engagement and interaction, and what I was hoping would be a relationship, because it's how I practice, where I just build strong relationships is kind of the core of what I do, and I was really hopeful that I would find that also. And this provider came, highly recommended, the front desk girl said, she's the best, go to her. So I walked in, and she walked in, I was sitting in there, and she walked in, and she was really visibly over what seemed like it had been a high stress day, which I can understand, too, taking in a lot of content, or maybe, I don't know, whatever could have happened. But I had empathy for maybe where she was at. But I found myself, versus, instead of kind of setting an expectation of having great care, which I kind of walked in with, the roles kind of reversed. She was high stressed, she was rushing. She never really looked into or asked about any of my medical history. She asked what some immediate symptoms were, do you have this or that? And said, oh no, that's fine. I'm great there. And then she said, well, everything looks great. Your labs look like a 20-year-old. And so she said, well, that's great that now you have a place to go. And I was thinking, and I just said that was my whole purpose, is to just have a general physical. I don't think that she really took the time to really check anything. Engagement was very minimal. It was very quick. She stared at her computer the whole time, which I'm hearing from providers that are friends that is just the way that they have to do it. I would just never do that with a client sitting in front of me. I just can't even imagine that this would be like the engagement. Yeah, oh, that feels so good. Oh, I'm so sorry that happened. It just feels so impersonal. There was just no opportunity to really build or establish a relationship with her. And so I left feeling just as though, one, I would never return, two, just really unseen. And I would remember her mostly for that, even though I took into consideration, I'm sure there's elements that went into why she was performing that way, whether the demands of the clinic, the stress of her day, maybe she had personal things going on in her life. But that also wasn't my job to be psychoanalyzing her either. I just was there to receive good care, and I felt like that didn't happen for those reasons.
Yeah, so my experience, negative experience, is when a physician has discounted what I have said. So, well, no, you probably don't have this, or this is probably not a real problem, or this or that is just not what typically should happen with you. And it's like, for me, it was like, okay, so I'm going to this expert, and so this expert is telling me that I shouldn't be having whatever symptoms I'm having, and so why am I having them? And so, and you can think about, okay, so you just need to get over it, Steve. You'll be fine. And so that really sets a person back, because you know what your life story is. You know what you're living. You know your experience, and you're like, well, okay, I guess I shouldn't be having it. And you can fall into that trap and continue to have whatever symptoms, and they can, more than likely you're going to get worse. And so having, my situation, my lived experience, my experience at that time being discounted or excused, is really a kind of a negative thing. As well as part of the thing about being black or African American in the U.S., I believe, is that I'll just speak for myself. I'm always suspect at why professionals or white people do what they do. Are they thinking that if I'm going to the doctor, I have pain, I have back pain, and I need something now because it hurts, and I can't move, I can't do anything. Well, are they thinking that I'm stereotypical? Am I out med shopping? Why am I here? It couldn't be that bad. And so that always plays in the back of my mind with almost everything I do in my life. And so why is it that this is happening? Does this happen to people who are not of color? Does it happen to everyone, or am I just paranoid? Now, paranoid or not, it's still a reality. And so, I have to decide, okay, am I going to let this affect me? It has already affected me. How am I going to deal with this? And I need to figure out and move on because I can get stuck in that as well.
That's funny you said that, actually. So I feel the same way sometimes when it comes to the medication aspect. It's like, oh, and then like, if you're in pain, like, oh, here's this pill. It's like, okay, you're gonna watch me take it, you think I'm gonna take it out of here or something. I understand where you're coming from with that. It's like, I don't even want any medication because I don't want to be that guy. So I like what you said. I think that's, I think several people feel that way. So as for myself, I'd have to say one of the things that frustrate me about providers is with African American black people, we have this thing where we bill report and we don't like change. It's like, okay, I trust this person and it's taken me a couple years to get to know this person, so we're tight. And then all of a sudden, it's like you go into your appointment, they're like, oh yeah, that provider's gone. It's like, oh, I didn't get anything in the mail. Like, so it's like, and another thing too is like, black people, we have this real tight relationship with God. So it's like, like when we go to the doc, I think if we have a hard time going to the doc, yeah, it's just like, let's pray. And I'm like more logical and like, hey, I'm gonna go to the hospital. But like, I have people in my family members that are like, God will fix it all. And I'm like, no, medication. I digress. So I think just having that rapport, and I don't know if it's something that, I think it's a whole health professional problem, is you have that rapport, especially in the African American community with all the Tuskegee experiment and all that. It's like, hey, so having that rapport with the provider that you've had for years, it's cool because it's kind of like, if you have a young woman that's been traumatized, now she has to go through the same victimization of like telling this new provider, and that's sometimes problematic. So I think that was one of like my experiences. I was like, got to the counter and they're like, oh yeah, do you have a doctor on this side of town? I'm like, what? So, and I don't know if any of you guys are familiar with like San Diego, but I had to drive all the way up to LA to see a doctor just for a physical. And if anybody knows, like the traffic in LA is insane. So it's like, wow, and I needed this physical to get out of like the military. So I'm like, they're like, yeah, your provider changed, like, and this was a civilian doctor, so it was kind of just like, oh. And I was like, oh, hey, yeah, did you get your A1C checked? It was high. And I'm like, dude, attention to detail, like, that's not me. So it happens, and I'm like, I'm like 22 and I'm like, my A1C shouldn't be high at all. Like, but I mean, it happens. So I was like, no. And he's like, oh, yeah, are you taking your blood pressure meds? And I'm like, yeah, you got the wrong person. So attention to detail is definitely, something that I think that should be, I think that's like not, I think some people aren't held accountable to the point where it's the simple things before you worry about the bigger things. So, yeah.
So I haven't personally had a negative experience with a provider. I will not proceed with a provider if their front office is not up to par. So that's something that is important. If the front desk woman is cold and ice, I'll cancel the appointment. And I have done that. And that's not the provider's fault, but I think as a provider in that office, your front office is a reflection, kind of like how I operate my school. My front office is a reflection of me as the administrator. So I would say that that's a big thing as a provider, that you're in a building where the front office staff is friendly and, you know, kind and answers the phone patient. Because if I'm calling in a panic about myself or my child, I need you to listen and not rush me to go on hold so you can find the nurse. You know, you may not know, you've worked in the doctor's office enough that you can at least listen and let me, you know, get that out. So that's the one negative. But another was when I was in college, and probably when you were born.
This is the road system.
But no, when I was in college, I had to take my grandmother to the doctor, and you mentioned the Tuskegee experiment, and so they couldn't figure out what was wrong with my grandmother, so the doctor's like, well, I think let's try this and let's try that, and my grandmother was getting very frustrated. So I finally looked at the doctor, I'm like, do you know what's wrong with her? And he's like, well, we're gonna try. I said, then how about we don't do anything until you can figure out what's wrong? I said, because right now, she doesn't trust anything you're saying, because you sound ignorant, and she's starting to have, you know, some visible trauma. And the Tuskegee experiment was like 600 years of, you know, families losing their fathers and then their children that it carried on to into 1973. So it's like my grandmother saw that constantly, you know, up until 1973. So, you know, black families, it's not there. The trust is not there a lot of times, especially with our, you know, grandparents and great grandparents. They did not trust a doctor. And so you hear, you know, this doctor is guessing, and, you know, every time we come back making a guess to try this and try that, and it's like, okay, it's okay if you don't know the answer. It's okay if you're not sure, and you just tell us, I don't know why this symptom is formulating. Let's look at your diet, and let's just start basic before you just start popping, you know, out pills to us. And that's my thing, is if you don't know the answer, it's okay. And a lot of, I think, physicians and providers are like afraid to not know. But I'd rather them not know and we just like wait out the manifestation of whatever's happening than it just be a guinea pig of a pill that's then gonna cause, you know, urethra problems, that's then gonna cause this, and then you're on a pile of pills. So.
My negative experience was one that actually almost killed me. About 7 years ago, I had just had a baby, and I had a C-section, and instead of my pain getting better, it kept getting worse. So I kept going back to the doctor, kept going back to the ED, and it was starting to be perceived like I was pill seeking, and they weren't really taking my abdominal pain seriously. Well, fast forward, about a month later, they realized that my appendix had ruptured, and I was toxic, I was septic, and I had to undergo an emergent open abdominal surgery. Ended up with a bowel resection, lost a huge part of my ileum, the distal part of your small intestine, and a huge portion of my colon, just because my complaints were not being validated. I often reflect back on that, and I ask myself, would it have been a different experience if I was not a black woman? And when they realized that I was someone who was educated and I could advocate for myself, before I actually got the second surgeon who came in, I demanded that I get a second opinion. And when they realized that I wasn't your stereotypical, you know, black person that you see on TV, that the media portrays as the image of a lot of black people, then they started treating me differently. And it just makes me feel bad for maybe someone who's not educated and they can't advocate for themselves. What would have been the outcome if I was not astute enough to say, no, I want a second opinion? And so it's really important to not just assume that, oh yeah, all these black people, they're on welfare and they're drug seeking and they're this and that. And that's a narrative that is pushed, I hate to say it, and it's uncomfortable. But I think we all have to get uncomfortable with that conversation. If we don't get uncomfortable with it, it's not going to change that narrative.
I'm glad you're here. I had a friend that is not here because a provider didn't listen to them. Last year, she had a breast reduction, something simple, but she was excited to finally have relief from her back. And we had talked about it, and she was excited, and she had done all the right things and started training with our friend to kind of lose a little bit of weight, so went through the steps to do that. And then had the breast reduction. And a week later, she had texted and said, you know, I've got this pain or whatever. And I said, oh, you should probably do a follow-up and just go to your doctor. And he didn't listen to her. Oh, you know, you probably just did this and that, and dismissed it and sent her back. And then a couple days later, she still was having this pain. It just wasn't the right kind of pain. But long story short, all those things, she became septic, and she eventually did pass away. And as I was standing in the room before they took the oxygen off, there was a guy standing there, and I didn't know who he was. Like, it was us, his family, and then there was just this guy, and all the nurses were coming in, but he hadn't been doing anything. And I finally said, who are you? It was her doctor. And I said, oh, you need to leave. You need to leave. And he kind of looked at me, and I said, no, you'll probably have a lawsuit, and if they don't do it, I'll make sure that they do it. You need to go. And you know, her parents at the time didn't know that she had gone back to him twice. I knew. I said, you need to go. And then I said, nobody talked to him. So that was just an odd thing that I kind of try to push out a little bit until you brought that up. But I don't know if it's because they think and they feel that we're, you know, and it's true, yes, we are strong, yes, but we have the same symptoms as everybody else. And I don't know if it's because as Black women we carry a lot and we don't go out for help, and we don't statistically have it, but we in our community have depression, we have mental illness, and it isn't until our generation now that we're doing both more than just prayer, right? And so our generation is uncovering that, but you know, I've witnessed, you know, aunts and mothers that have had depression, but they just don't go to the doctor. And so we have the same characteristics and symptoms, but because we don't choose to go to the doctor doesn't mean we're any stronger than anybody else. So, yeah.
I just want to say thank you for sharing all of those, you know, stories. And sorry you both had to go through something really hard, and that you lost a friend, and then you had to now deal with something that is permanent. And we're definitely here to learn. We're definitely here to prevent that from happening to our community members, and we really appreciate your stories. One of the things that I found all your input very valuable, and I feel like history and the current treatment that African Americans still receive, it's obvious that there is unequal treatment, and in the healthcare, and then this continuation just continues to validate the fears and the mistrust in our community. So we definitely need to hear more those stories, and then keep that in mind. And then just as some of you share, like the concerns about feeling discounted or disregarded, we should be aware of that. And then also the previous history about the Tuskegee, and then like you just said, feeling misvalidated or not validated. So we'd like to open up our Q&A session. So please feel free to make any comments or ask any questions. And yeah.
Hi, thank you for being here. I appreciate all of your stories and input. It's very educational. I'm sorry, I can't remember your name, the gal in the beautiful green.
Michelle.
I'm curious if they ever figured out what was going on with your grandmother.
Yes, they did. They did. She had cancer that had spread everywhere. So they were treating the wrong symptoms. Yeah. But she was able to stay with me like for 5 years past that, because she's strong as a rock, but yeah.
Is it Raphael?
Yeah.
Sorry, I missed the intros. But do you feel that the same barriers and like cultural separations are equally sorry, I didn't word this in my head first. In the VA system, are they the same as not in the VA system as far as barriers and things that you have faced either on the positive or negative side?
I'm a veteran, so I'm gonna give you the honest truth.
Yeah.
I think the VA, it depends. I personally like VA healthcare. It's something that I've been around forever. So, and we have a lot of like medical students that go, and it's really neat. But I think it's different. When you go to the civilian sector, it's like like one time there's a guy that came in. He had Medicaid. I think it's Medicaid. Another person Medicaid, and I had like 3 or 4 people ahead of me. Right? I had TRICARE. I was taken care of just like that. Now, in the VA healthcare system, you're equal, and it's this unspoken rule, like he's obviously older than me, big, but I have a military mindset. So if he came in and I was there before him, maybe I showed up at like 9, he got there at 11. I'm gonna make sure he goes before me. It's a military mentality, so it's different. It has its pros and cons. I think the civilian sector is a little better. They have more assets and pretty toys and labs and all that stuff. And the VA healthcare system is cool, but it's just a different world in the VA healthcare system versus the civilian sector. And I think when it comes to the civilian sector, there's a lot of pros that we could take from the civilian sector and merge those into the VA healthcare system. And I think from the VA healthcare system, we can merge both. There's both pros and cons. I have free healthcare, and it's great, but it's the VA here, for instance, every VA is completely different, very different. And this is a great VA, but the need here is completely different than like LA. And usually most VAs are in the hood, bad neighborhoods, whatever, and this one isn't, whatever, and it's different. Like you could come here and get seen in Albuquerque, for instance, when I was a social worker there, like the need was catastrophic. Like it's just boom, boom, like you're getting everything. Here it's different. I feel like in Utah, the church is very involved, the LDS church is very involved in how things are, how can I say this? Because I don't want to offend anyone. The church, I see that the church is more involved with homeless versus like a lot of different places, like, they don't care. Here, it's cleaner, the VA's cleaner, it's completely different than Albuquerque, LA, Hawaii, Detroit, Chicago, Miami. It's like, the need is insane, and then Salt Lake is smaller, so that's a really good question. I don't know, have you ever been to the VA or have had friends?
Yeah, I haven't been treated, but I have been there as like a learner.
Okay.
So
And have
half
you-
a provider, I guess.
Have you noticed the difference between treating veterans and treating just, other civilians?
Yeah, so I've noticed different, I guess, in like short story, I've noticed a difference in the treatment and the resources and the time allotment and the time that it takes from someone to get into the ED into a specialist, but I am biased in my view of like racial differences and disparities because of how I've grown up and where I've come from, so I wanted to get your take on that within the VA system as well.
And then one more thing for you. So like, I'm not from Utah, I'm not LDS. I do believe in God. However, I have clients that are LDS. So I went to a couple wards. I actually went, because I like to educate myself. and it's powerful. So when people, they come to you, they're like, oh my God, this black guy actually went, and I was like the only brother there, but it was, I didn't care about the color aspect of it more so than, I need to know the background of these people. So get yourself a black friend, Latin friend, something, get a black friend, and they can tell you some of the things you don't know. It's cool, it's like, hey bro, like, no, like, don't do that. And one more thing is, black women are treated, like when it comes, like, as a provider, like the biggest thing I can give you guys as a provider, I don't think anyone in this room is racist, but when you go and you deal with a black woman, they have been through so much. It's just like, just the day, like as a black man, that's another story, but it's not even in comparison what a black woman goes through. And I know this specifically, my mom's black, but my mom dropped out of medical school twice. She made it, but it took her a very long time. And my parents went to school in the 60s, you know what I mean? So it was already hard. And then, you know, you're a doctor, but you're just a black doctor, like who cares? Like, you know what I mean? So when you're dealing with people, and it shouldn't even just be just for black people, it should be for all people. You don't know what walks of life, what happened before they came to see you. Just be mindful and try to educate yourself on other different cultures and stuff like that. There's not a culture I don't know about because I was in the military, so it's great. Like, you know, I like learning, and I think that if you're gonna treat African Americans specifically, learn about the culture, because black people are pretty cool. So just saying, like we try, like it's cool. Like, it's just, yeah, it's cool. And I have a lot of white friends that are just like, dude, you're dope, and I'm like, you're dope too. But like, it's not. I don't want you guys to be like, oh man, like black people probably have had all these horrible experiences from white people. There's just as many great white people as there are anything else. I think the biggest point is just branching out a little bit and understand that, like, hey, you know what? It's not all about me. Like, you know what I mean? Like, it's hey, I want to know this woman's stories. I want to know this person's story. I don't care what color they are. Treat them with the kindness and dignity and respect they deserve. And that's pretty much it. You know what I mean? So, yeah. I'm yelling, but